Accidents happen, and Dr. Karen Calkins says if you have a bad cut, cleaning it out is always a good first step.
Wash it gently, keep it clean, put some kind of clean dressing over there.
But sometimes your body needs help to heal. That's where stitches or sutures come in.
Basically, wounds that are kind of gaping in the skin there, or if the bleeding won't stop, are things that really need to be looked at to see if they need stitches.
Stitches are one of the services that can be done at one of the 5 Lee Convenient Care locations.
The nurse will go out and take a look at it, uncover it, and see, how urgently it has to be brought back and sutured. And then we just bring the patient back, and the provider will go in and assess the wound. And then they'll usually use some local numbing medicine and clean it out really good and suture it up and put a dressing on.
Stitches can remain in place anywhere from 5 to 10 days, depending on the location and the severity of the injury.
Besides holding those edges of the skin together so it heals well, so there's not a big gap there as it's healing, it also can help prevent some infection down the road because now you've cleaned that well and you've closed it up.
Dr. Calkins says you should be careful when using things like hydrogen peroxide.
Because it can be toxic to the tissue, it's pretty strong. If you're really going to use it, you want to dilute it out a little bit, but really just some soap and warm water to start.
To find Lee's Convenient Care locations, visit leehealth.org. For Lee Health, I'm Devin Turk.